In my house, you have to recover quick.
You wanna do it again?
Yeah, absolutely.
Alright, small steps around. Up the railing again. I'm gonna stay in front of you just so I can see. Nope.
Really?
Okay, I'll get out of the way. I'm telling you. It's you.
Well, it just feels so different. I don't know if that's common or not, but when I walk with my left one, I can feel everything still like I did with the right. I don't feel
Grinding
any of that
and
right now.
Yeah, you're doing awesome.
Who was the doctor that did this?
I don't know. Some guy we found in the back alley.
He did all right.
I'm gonna grab this,
Yeah.
Trained you.
Alright,
Okay,
I can head back over.
back over.
Well, we did everything?
Yep, I took his ID out and he's good.
Straight ahead, Mr. Andy.
On cam again.
Back up to the other chair.
I know, I'll get it. I'm a guy, when do we ever do anything right?
Always reach for the chair.
So,
Whoa.
so let me have you bring your knee straight out for me. Kick it straight out. Good. Bend it all the way back. Further. All right.
Chairs in the way.
All right. That's great.
You could scooch out.
And this is how far after your surgery now?
I don't know, 2 hours?
2 hours. Okay. That's very good. All right. We'll let you go home.
Thank you. Appreciate that.